What risks are associated with multiples, both in pregnancy and in birth? What are doctors and scientists doing to address this issue? So, why is a multiple pregnancy a concern? Being pregnant with more than one child is referred to as a multiple pregnancy. For many couples, it is a pleasant occasion. Multiple pregnancies, on the other hand, carry a larger chance of problems. So here is the list of the most prevalent issues. So first is premature labor and delivery. Preterm birth affects more than 1/3 of twins and nearly all higher order multiples born before 37 weeks. The bigger the number of infants in a pregnancy, the higher the chance of an early birth. Premature birth occurs when a baby's body and organ system have not fully formed. These infants are frequently tiny and have low birth weights. This equates to a weight of less than 5.5 pounds or 2,500 grams. They may require assistance with breathing, eating, fighting illness, and maintaining body temperature. The term very preterm refers to babies born before the 28th week of pregnancy. They are in greater danger. Many of their organs may not be ready for life outside of their mother's uterus, or they may be too immature to function properly. A neonatal critical care unit will be required for many multiple birth kids. Next is gestational diabetes. Gestational diabetes is more frequent in women who have had several pregnancies. Next is anemia. Anemia is more than twice as likely in women who are expecting multiple children. Next is birth defects. Multiple birth babies have about twice the risk for certain problems present at birth, or we call it congenital. This includes spina bifida and other neural tube defects and problems of the digestive tract and heart. Next is miscarriage. In multiple pregnancies, a situation known as vanishing twins syndrome is more prevalent. It occurs when more than one fetus is discovered but then vanishes or is miscarried. This is common during the first trimester. This may be accompanied by bleeding. Pregnancy loss is also more likely in the third and fourth trimesters. So we have two examples of twins. We have a healthy twins and twins with TTTS. So what is TTTS? TTTS, or twin-to-twins transfusion syndrome, is a placental disease that only occurs when identical twins share a placenta. Within the placenta, blood veins join and channel blood from one kid to another. It occurs in roughly 3 out of every 20 twins who share a placenta. So here is another example, abnormal amounts of amniotic fluid. So amniotic fluid problems are more common in multiple pregnancies, especially for twins that share a placenta. Next is cord entanglement. The umbilical cord for the twins that share an amniotic sac can become tangled up. In these cases, the babies may need to be monitored, often in the third trimesters. So for the question is, what are doctors and scientists doing to address this issue? At each visit, the doctor will do a physical examination. It is critical to attend all appointments. The doctor may also do a fetal ultrasound, check blood pressure, and test the blood and the urine for any symptoms of abnormalities. Early therapy can help the mother and her children remain healthy. Doctors encourage patients to have bed rest at home or in the hospital depending on their health state. So this is the guidelines can help. So first is get plenty of sleep. Second is exercise, but avoid any exercises that put you at risk for a fall or injury. Next is eat a well-balanced diet. Don't eat sweets, cakes or cookies, and avoid hormones or antibiotics in your food. Include foods that promote blood flow like pomegranate, beets, leafy green vegetables, and berries. And I will also include that find some quiet time for yourself in a peaceful spot. The doctor will advise moms must be selfish. They must take care of themselves and be in sync with their bodies.